I'm Suburban Prepper, paratrooper flight medic, combat veteran, and family nurse practitioner. This knowledge was earned, and what I know could save your life. Now the alternative medicine side, natural antimicrobials. What actually works, what the evidence says, and what you need in your grid-down pharmacy right now. Let me be clear before I start. I am a licensed family nurse practitioner with a GWU fellowship in alternative and complementary medicine. I am going to give you the honest, evidence-based assessment, not the sales pitch version you find on supplement websites. Colloidal silver. Colloidal silver has documented antimicrobial activity in laboratory settings. It has demonstrated efficacy against a range of bacteria, including MRSA in vitro, meaning in a petri dish. The clinical evidence for internal use is less robust. The FDA has stated there is no evidence colloidal silver is safe or effective for treating any disease or condition. However, in a grid-down scenario where pharmaceutical antibiotics are unavailable, topical colloidal silver applied to infected wounds has reasonable supporting evidence. It is used in burn care in clinical settings in the form of silver sulfadiazine. Colloidal silver as a topical wound wash or dressing is a defensible choice in austere environments. What I do not recommend: drinking it internally as a primary infection treatment, relying on it as an antiviral. It has no meaningful evidence base as an antiviral agent. Oregano oil. Oil of oregano contains carvacrol and thymol, two phenolic compounds with demonstrated antimicrobial activity. The evidence base for oregano oil as a topical antimicrobial is reasonably solid. As an internal treatment for serious bacterial infection, the evidence is not strong enough to rely on as a primary treatment when pharmaceutical antibiotics are available. In a grid-down scenario without access to antibiotics, a 1-to-1 dilution of oregano oil in a carrier oil applied topically to an infected wound is a reasonable adjunct. Do not apply undiluted oregano oil to skin or mucous membranes. It is caustic and will cause a chemical burn. Raw honey, specifically Manuka honey. This is the one I want to spend the most time on because it has the strongest clinical evidence base of any natural antimicrobial in use today. Manuka honey, produced from the Leptospermum scoparium plant in New Zealand and Australia, contains methylglyoxal, MgO, at concentrations that have demonstrated broad-spectrum antimicrobial activity, including against MRSA, Pseudomonas, E. coli, and other significant pathogens. Manuka honey is used in hospital wound care in clinical settings right now. This is not fringe medicine. It is evidence-based wound dressing. The mechanism involves osmotic action. The high sugar concentration draws moisture out of bacterial cells, combined with the specific antimicrobial activity of MgO and hydrogen peroxide production. For grid-down wound care, Manuka honey with a UMF rating of 10 or higher applied directly to a wound as a dressing is a legitimate clinical-grade intervention. Cover with gauze. Change the dressing every 24 to 48 hours. The honey maintains a moist wound environment that promotes healing while inhibiting bacterial colonization. A jar of UMF 10 plus Manuka honey runs $20 to $40, depending on the size and source. It belongs in your grid-down medical kit. It has a long shelf life. It works. Garlic. Allicin, the active compound in freshly crushed garlic, has demonstrated antimicrobial activity in laboratory settings. Fresh garlic applied topically to infected wounds has folk medicine support and some laboratory evidence. Internal use as an antimicrobial for systemic infection does not have a strong enough evidence base to rely on in a serious infection scenario. What garlic is genuinely good for in a preparedness context. Immune support as a dietary addition. Antimicrobial properties as a topical adjunct in minor wound care when better options are unavailable. Here is my grid-down antimicrobial priority list in order of evidence strength. First, pharmaceutical antibiotics you have legally stockpiled with your prescriber's support. Second, Manuka honey UMF 10+ for wound care. Third, topical colloidal silver as a wound wash. Fourth, diluted oregano oil as a topical adjunct. Fifth, garlic as a dietary support measure. Build your grid-down pharmacy in that priority order. Do not let perfect be the enemy of good. If you cannot get pharmaceutical antibiotics stockpiled, Manuka honey in your kit is a meaningful upgrade over nothing. We have over 400 modules of real-world preparedness training built by someone who's actually been there. Start your training today at tpp.suburbanprepper.com. This is survival. This is resilience. This is preparedness.